hemoglobin levels, comparison with cigarette smoking. Dr. Fasalino from Greece.
Thank you very much, dear Chairman. The title of the study was, we wanted to investigate the immediate effects of electronic cigarette use on coronary circulation, blood carboxyhemoglobin levels, and compare this to the effects of cigarette smoking. We have nothing to declare as authors, however, our institution was funded by an e-cigarette liquid manufacturer. None of the authors received any financial compensation from the sponsor or from the institution. We know that e-cigarette is a relatively new product in tobacco harm reduction. It has been developed due to the inefficiency of currently approved methods for smoking cessation. We know that nicotine replacement therapy products have a lower than 6% long-term success rate in smoking cessation, and even oral medications in the most carefully planned trials have a less than 20% success rate. However, it is a new product. We cannot perform any kind of long-term studies to evaluate the safety from long-term use. Therefore, we have to do several other short-term studies or evaluate the pathophysiological mechanisms that are related to smoking related disease, and then check what is going on with electronic cigarette. Smoking, we know it's the most preventable risk factor for cardiovascular disease, particularly associated with acute cardiovascular events. Concerning this study, we decided to study the effects on the coronary microcirculation because there were already several studies published which show that smoking has an immediate adverse effect on coronary blood flow, and even passive smoking has such effects. Therefore, the purpose of this study was to evaluate the immediate effects of electronic cigarette use on coronary microcirculation and on blood carboxyhemoglobin levels, which are used to detect carbon monoxide exposure. The materials was, of course, a cigarette and an electronic cigarette device, which was a second generation device consisting of a battery, which you can see here, the atomizer, so-called, which is the part of the device where the liquid is stored and where it is evaporated, and it is a refillable atomizer, and the electronic cigarette liquid with 18 milligrams per milliliter nicotine. It was a mistake during the abstract submission where we reported that it was a 9 milligrams per milliliter of nicotine. The methodology was to assess coronary flow velocity reserve by using intravenous infusion of adenosine at a dose of 140 micrograms per kilogram per minute for 2 minutes. And we also assessed coronary vascular resistance index, which is an index of the resistance to the blood flow to the coronary arteries. The protocol design, we included 60 participants divided into two groups. One group were smokers, daily smokers of at least 1 year, at least 10 cigarettes per day, and the other group was electronic cigarette users who had completely quit smoking for at least 1 month and were daily users of an electronic cigarette device. They were healthy without any risk factors for cardiovascular disease besides smoking and without any clinically evident disease. We asked them to visit our clinic after an 8-hour abstinence from smoking, e-cigarette use, and additionally alcohol and food intake. We performed the baseline coronary flow velocity reserve and vascular resistance index measurements, as well as carboxyhemoglobin measurements. Then for the group of smokers, we asked them to smoke 2 cigarettes in 15 minutes. On another day, and it was a randomized crossover design, we asked them to use an electronic cigarette with the 18 milligram per milliliter nicotine concentration for 15 minutes, and we did a repeat measurement. For electronic cigarette users, it was of course unethical to give them the e-cigarette. They were all a tobacco cigarette. They were all former smokers, so we just used an electronic cigarette device similar to what was used for smokers. I have to stress and mention that the repeated measurements were performed 20 to 30 minutes after smoking or e-cigarette use in order to avoid the hemodynamic effects of nicotine, because you know that heart rate and blood pressure has an acute and direct effect on the velocity of blood flow to the coronary arteries. Therefore, we know the acute hemodynamic effects of nicotine, and that would cause an increase on the baseline measurement of velocity, which would decrease the flow reserve. In order to make sure that I will show you later the results of the hemodynamic measurements. The baseline characteristics of the two groups were identical, no difference in their smoking duration and cigarette consumption. The electronic cigarette users had a mean period of 9 months using the devices, and they had quit smoking for about 8 months. The hemodynamic measurements, ejection fraction and cholesterol levels were similar in both groups. Concerning smokers, before and after smoking 2 cigarettes, you see that there is no hemodynamic change. Of course, I'm talking about 20 to 30 minutes after smoking the cigarettes, that's why. There is no change in systolic, diastolic blood pressure and heart rate. Similarly, after using the e-cigarette device and after 20 to 30 minutes also, no change in hemodynamic parameters. And the same for the e-cigarette users before and after using the e-cigarette device. Once again, 20 to 30 minutes period from the time they use the device until the repeated measurement. Here are the results. Coronary flow velocity reserve in smokers after smoking 2 cigarettes, we saw a significant 16% decline in coronary flow velocity reserve. This is in line with previous studies, which in fact have shown that the difference is much higher. There are studies showing approximately 25 to 30% decrease. Probably we were close to the 30-minute interval between smoking and repeated measurements. That's why the difference was not so high, but still it was statistically significant with a p-value of less than 0.001. For coronary vascular resistance index, there was an increase in the resistance to blood flow of 19% post-smoking 2 cigarettes. Now, the same group of smokers after the electronic cigarette use. There was absolutely no difference in both coronary flow velocity reserve and in coronary velocity reserve, vascular resistance index. Both baseline and post-use values were similar for both measurements. The e-cigarette users, which used only the electronic cigarette, we didn't give them tobacco cigarette to smoke, they also showed no difference in coronary flow velocity or vascular resistance index before and after using the device for 15 minutes. For the whole sample, so these are the results for all 60 patients, all 60 participants because they were healthy, before and after using the e-cigarette device, we see that there is no difference in both flow velocity reserve and vascular resistance index. Blood carboxyhemoglobin levels. There was a significant difference in carboxyhemoglobin levels, even at baseline, between smokers and electronic cigarette users, which I must remind you, they were all ex-smokers. They were not smoking. They were not smoking for at least 1 month. After smoking 2 cigarettes, we observed a significant elevation of carboxyhemoglobin levels in blood, while after using the electronic cigarette, no difference was found in smokers. Similarly, in electronic cigarette users, there was no difference in carboxyhemoglobin levels before and after using the electronic cigarette device, indicating that there is no combustion from the electronic cigarette and no carbon monoxide is produced. In conclusion, smoking causes immediate adverse effects on coronary microcirculation, as we know from previous studies, and our study is in line with these studies. The electronic cigarette use has no immediate adverse effects on coronary flow velocity reserve or coronary vascular resistance, and no carboxyhemoglobin elevation was observed after electronic cigarette use, confirming the absence of combustion. Therefore, this study adds to currently available evidence, which supports that electronic cigarettes are significantly less harmful compared to tobacco. And unfortunately, there is no way to perform any long-term studies because it's a new product. Monitoring of consumers for several years are needed in order to determine the long-term effects of electronic cigarette use. Thank you very much.